Good morning. Mr. Speaker, members, today's the day we talk about House Bill 1. And this is the state budget for the biennium 12 and 13. I know you've heard a lot about what House Bill 1 does and what House Bill 1 does not do. And I know many of you probably have questions and concerns about what this budget does and doesn't do. Before I get into any specifics on what this budget does, I would like to talk to you about what it doesn't do. And I would like to talk to you about how we got there. This budget does not raise taxes. It does not rely on any spending, any new tax revenue to pay for programs or services. This budget does not spend any federal stimulus money. We had extensive debate last session about the pros and cons of accepting the federal stimulus money. Ultimately, we decided Texans' tax dollars were best spent in Texas. We spent it with the understanding that it was only a one-time only expense. This budget does not spend any of the rainy day fund on any ongoing programs or services in the next biennium. Yes, the action that we took yesterday freed up $4.3 billion. But this budget does not spend a single dollar of the Economic Stabilization Fund on ongoing programs or services in 2012 or 2013. Finally, this budget does not grow government. This budget reflects the economic realities facing our state, and it only spends available revenue. This bill, combined with the votes we took yesterday on House Bill 4 and House Bill 275, fulfill our constitutional responsibilities to a balanced budget. If she had to, the comptroller could certify this budget today. Now let's talk a moment on how we got there. In January 2010, it was clear that the full effects of the economic recession were hitting our great state, and revenues were beginning to decline. At that point, the Speaker, the Lieutenant Governor, and the Governor wisely directed agencies to begin identifying budget reductions. Last spring, Speaker Strauss joined the Appropriations Committee to take the first hard look at the effects of the economy on our state budget. It was clear to everyone at that point that the budget we would be debating this session would have to rely on less revenue. When I began work with the LBB staff last fall, drafting the introduced bill, the Speaker and I agreed on 4 principles. The budget would live within available revenues. It would not rely on any new taxes. It would not assume spending from the Economic Stabilization Fund, and it would reflect limited government. The budget that was drafted by the Appropriations Committee not only makes spending cuts, not only does the budget spending cuts taken in 2010-2011, it also reflects the 10% reductions required in 2012 and much more. Our actions yesterday in passing House Bill 4 and House Bill 275 reflect our commitments to address the current shortfall. And the steps we have taken allow us to apply an additional $4.3 billion to the next biennium. But I want to give you a clear understanding of where that $4.3 billion is being spent. We allocated money to items we identified as the most critical by putting $2 billion into the Foundation School Program. $2 billion in Article 2, the majority of went into our Medicaid caseload, and $300 million into adult and juvenile corrections to ensure the public safety. Members, we applied this money to the most pressing and essential needs of our government. Now let's talk about what this budget does. Everyone here today has heard from their constituents about what this budget does and doesn't do. Today is our opportunity to talk about those things and to potentially change them. But before we get to that point, let me talk about some of the significant changes that have been made. The all funds reduction for 2010-2011 is $22.9 billion, or a 12.3% reduction. The largest part of this is the elimination of slightly more than $12 billion in federal stimulus money that we appropriated last session. Yes, Texas received more than $15 billion in stimulus money, but members remember, that was over a 3-year period. The amount appropriated in the 10-11 budget was just over $12 billion. This number also reflects significant cuts in general revenue, and Texas receiving less in federal matching funds. In terms of general revenue spending alone, this budget cuts $4.5 billion, or a 5.4% from 2010 and 2011 levels. This cut is in addition to the more than $1.3 billion in general revenue that we cut in House Bill 4 yesterday. Members, this budget makes cuts in addition to the 5% and 2.5% cuts we ordered for this biennium. Members, let's take a moment to recognize the amount of work that the committee has done to get us to this point. Believe it or not, since committees were announced in February, we met 59 times in full committee and our subcommittees to address this budget shortfall. The members of this committee spent more than 215 hours listening to public testimony, exploring budget cuts and solutions, and debating the questioning how to best address these challenges. This process was not easy, but it was essential, and each member recognized that early on and truly committed themselves to this effort. I am humbled by the work each and every member of this committee has put in. For as long as I've been on Appropriations Committee, 2 parts of our budget have driven the vast majority of state spending. That is education and health and human services. It was true when I was first appointed, and it is true today. Education remains our largest expenditure. We increased GR spending of the Foundation School Program by $857 million. Yes, under current law, this spending does not meet our full obligation. But this bill assumes a school finance will be addressed this session through separate legislation. Members, in Article 2, it is clear that there is not sufficient dollars to address the current estimate of caseload growth. And yes, in addition, our nursing homes and hospitals are facing significant rate reductions, along with every other Medicaid provider. These are issues that we did not ignore and we will not ignore. And the Article 2 subcommittee worked to maximize every dollar they had to spend. And members, I will promise you today that before we bring back a conference committee report on House Bill 1 to you, we will continue to address the problems that House Bill 1 has for Texas grants, Medicaid, public education, and nursing homes. Members, we are about to discuss hundreds of amendments. We are going to debate our priorities in each and every article of the budget. This is just the start of the debate and is definitely not the finish. This is time and the place to debate the issues that reflect our priorities.